I'm Courtney Wagner, and this is In the Game. I'm sitting here with orthopedic surgeon Dr. Brett Frykberg from the Jacksonville Orthopaedic Institute. Dr. Frykberg, thank you for being here.
Thanks for having me.
Absolutely. So, you grew up in Jacksonville, you're a native here, this is your community, you're serving on a daily basis now. How does that feel?
It feels amazing. It's been a lifelong dream to come back, and it's even better to do it in such a fashion to where the guys that took care of me when I was younger, I get to do the same thing. So I know I'm affecting other people's lives, especially the high school kids and the high school athletes. So it's been great.
Exactly. And you're going to see that go full circle from when you were an athlete and now you're taking care of those athletes. You went to Bishop Kenny High School. Tell me about your experience there, what sports you did.
I did a lot of sports at Kenny. I was football in the fall, wrestling in the winter, and then track in the spring. And I ended up doing track in college. But these guys, the orthopedic surgeons here at JOI, took care of me when I had my many injuries, probably leading to my becoming an orthopedic surgeon. And they're still working here today. My trainer is still working here today from Kenny. So it's a good family environment that started a long time ago.
Absolutely. I mean, to make your career in the community you started in is not something a ton of people can say. And I know you said, you ran track in college. How was the multitasking of that while taking on the profession you did?
It was difficult, but very fun. I went to the University of Tennessee. We had multiple Olympians on our track team. I was a decathlete, so I learned to multitask very well. And they gave me a lot of time to study and to really do what I needed to do to become a physician.
Sure.
I didn't always want to be a physician. My dad was one. My older sister's an OB/GYN out of Baptist. And I wanted to do something different. I wanted to be at home with my kids. I wanted to, to interact differently than they do. But I found myself in college leaning more and more towards the medical field. And after a long, internship, so to speak, during the summer times at the hospital, I really found my calling. And there's no other job on the planet that I would be happy doing other than this. So I was at the right place at the right time, and
definitely
it fed me into becoming an orthopedic surgeon.
Well, it's great to love what you do and do what you love, and you really exemplify that. And I know another love of yours is golf, and someone got to play on the Augusta course. So tell me a little bit about that.
Again, right place at the right time. It's just kind of falling in line. So a friend of a friend joined with a company that operates out of Augusta, and he was asked if he wanted to play golf at Augusta National Golf Course where they play the Masters. And I happened to be standing there at the same time, and he said, "You can bring a friend." And
pick me.
And it was a dream come true. It's not often where you get to play a course or do something in life where you're looking at yourself saying, "I'm actually living out the dream I've had since I was younger." And I think that's a dream a lot of people share, and I'm very, very blessed and very lucky to have done that.
Definitely, because the course itself, it's only open a couple months out of the year. Even people, spend years on a list hoping to make it to the Masters. So what was it like golfing on the same course that all these professionals are making history on?
Well, I wouldn't say I made any kind of history, but it was amazing. I mean, literally, it was a dream come true. It's like hitting off of the most perfect carpet you've ever seen in your life. There's not a blade of grass out of place, and it's absolutely true what everyone says about the course. And I had never been there before. I'd never seen the Masters up close as a fan, just on TV, and it was every bit of historically amazing as it can be.
Definitely a once-in-a-lifetime opportunity.
Absolutely.
No
Hopefully
doubt.
twice, maybe 3 times.
And I know, too, one of your specialties is the Birmingham Pip Procedure. Can you walk me through that process a little bit?
Hip resurfacing, as it otherwise is known as, is a procedure for young, active male patients. Males just did better than females over the first 13 or 14 years, so it's really limited to males in general, but it requires a lot of extra training. It's not one that you can see one and do one and teach one.
Right,
so I spent a year up in New York spending a lot of time with hip resurfacing with one of the world's most renowned hip resurfacing surgeon there is, and he took me under his wing, and I learned a lot, and I'm still learning a lot about the procedure, and patients are doing very well with it. It's a bone preserving procedure. You could say it's a bone-preserving total hip replacement because the process is more invasive, but the results are that patients are able to do a whole lot more, worrying about a lot less than having a hip replacement.
Right, so overall, really, really good results. And
very positive
who
results.
would you say would qualify as an ideal candidate for this procedure?
Young, and young is not a number. Young is a functional age of somebody. It truly is. And people that we label them as millennials, but not necessarily those that were born recently, but people that like to surf, people like to hike, people that like to mountain climb, people that like to run, people like to do triathlons in Florida, play tennis at high levels. I mean, this is a procedure really to say, hey, it's not your grandfather's total hip replacement you had 20 years ago. This is dealing with a serious problem you have and getting you back to the functional level that you like to be at. We operated on a major league pitcher who's a big proponent for the Birmingham Pip Resurfacing arthroplasty, and he still is pitching for the Rangers. I mean, you can't have a total hip and do professional sports like that. But you don't necessarily have to be a professional athlete, nor will it make you a professional athlete. But to get back to the level of function that you were prior to having such bad hip arthritis and hip pain.
And I know you mentioned, you see a lot of different athletes, a lot of different age ranges. Is there a most common injury you see?
Not necessarily for the hip. And sometimes we can't find an injury, but the commonality is severe arthritis, range of motion loss, and power loss for those people who do high-level sports because of the arthritis. Then those are the best candidates possible for resurfacing and really for a total hip if they so choose. But it's another option in a repertoire of the many options we have for treating hip pain at JOI, from scopes to totals to resurfacings.
Right, so they have a lot of different options to pick from, and depending on their age, maybe a certain option fits them better.
Exactly.
Excellent. And what is your favorite part about working for the Jacksonville Orthopaedic Institute?
I think we touched on it already, but it's joining the group that took care of me when I was younger.
That full circle.
We are truly a family. We cover every aspect of orthopedic surgery, from spine to sports. Obviously, we take care of all the major sports teams in Jacksonville. We have two extremely good hand surgeons here in San Marco, and we have one at Baptist South who, they take care of any complex hand injury there could be. And it's great having that. If you have a patient I can do a hip replacement on and say, oh, well, my hand hurts and I'm doing this, and I have the perfect person for you to go see. Or I have my spine hurt, or I have, radiating pain down my legs for my lower back. And you know what? I have a great person for you to see. I don't have to worry about sending them elsewhere. It's just a complete family. You all really do treat your patients like family too, which is what I think separates your institute so much from other places. Right. It's not a numbers game. You don't come in line and take a number and wait to be seen. You really feel like you're part of it. And that's what I felt like, 10 years ago, 20 years, whatever it was when I was in high school, coming in here, you really treat like you're the professional athlete and you're the person that they're here to see. I'm not here to see them. Exactly. Well, Dr. Frykberg, thank you so much for what you do for this community. Thank you for being here today, and we look forward to speaking with you more in the future. Well, thanks for having me. I appreciate it.